Today's topic is skull bone. We are going to study the bones which contribute to form the skull bones. So this is skull bone. The front part of the skull bone is called norma frontalis. This part is called norma frontalis. The lateral part of the skull bone, this is called norma lateralis. This is norma lateralis. And this is norma lateralis. And the posterior part of the skull bone, this part, this is called norma occipitalis. So there is some sutures in this part, the superior part of the bone. This camera, the superior part of the skull bone, this is called norma verticalis. Vertex. It's called vertex, norma verticalis. There are sutures. This is a type of horizontal type suture. This is suture, and there is also sutures. This suture is called coronal suture. This suture, this is called sagittal suture, and this is called lambdoid suture. The bone, this is parietal bone. This is parietal bone. This is parietal bone, two parietal bone, and the sutures that divides the two parietal bone is sagittal suture. And this is coronal suture. This is coronal sutures. Coronal suture separates frontal bone from the parietalis bone. This is frontal bone, and this is two parietalis bone. This bone, this is called occipitalis. That is present in posterior part of the skull bone. This separates from parietalis from the occipital bone. Lambdoid suture. This is lambdoid suture. This bone, this bone here is called temporal bone. Let's learn about the norma frontalis. This is to orbit which accommodates the eyeball, and there is a margin above the orbit. This is called supraorbital margin. This is supraorbital margin, and there is arch, bony prominence here. This is called supraorbital arch. This is supraorbital arch. This point, it's called glabella. This is glabella. There is two small bone. This is this and this. This part, nasal bone. This is two nasal bone. This part. Here is a point where the frontal bone and two nasal bone meets. This point is called nasion. This is nasion, and here it's glabella. This is nasion. There is two prominence here. I have marked with red color. This is called frontal prominence. This is frontal prominence. This prominence. Here is where the cheek is present, cheek prominence. It's called zygomatic prominence, and this is the zygomatic bone. It articulates with the frontal bone and with the zygomatic arch of temporal bone. This is zygomatic arch of temporal bone, and this is zygomatic bone. Zygomatic process of zygomatic bone articulates with the zygomatic arch of the temporal bone. This bone, this is maxilla. Maxilla has, this is front nasal process or frontal process. This is zygomatic process, and there is alveolar process. There is alveolar socket, which alveolar border, which has sockets for accommodation of the teeth. This is maxilla bone, two maxilla bone. It is paired bone. The inferior part of the skull bone, this portion, this is called norma basalis. This is norma basalis, and the large hole here, this is called foramen magnum. This portion is nasal aperture. This portion is nasal aperture. Here is the midline which separates the two nasal cavity in two parts. This is nasal septum. This is nasal septum. It is the lateral wall of nose. This portion is the lateral wall of nose, and from here it is a hanging bone, the small fragile bone. This is inferior nasal concha. This is inferior nasal concha. From the lateral wall, it's hanging. It's an inferior nasal concha. This bone, this is the temporal bone. This is the squamous part of the temporal bone. This portion, this is called mastoid process, and here it is styloid process. It is external acoustic meatus. This is external acoustic meatus. Squamous part of the temporal bone. This is mastoid process. This is styloid process. This is external acoustic meatus. On the opposite side, see squamous part, mastoid process, styloid process, external acoustic mirrors. That is the zygomatic arch. Okay. This portion, the parietal bone. See, here is a prominence. It's called parietal prominence. This is the parietal prominence. It's more prominent in female than males.